Another possibility which can occur as a sequelae of pulpal and periapical infection is inflammation of the soft tissue components of the bone, which is called as osteomyelitis. Osteo means bone, myelo means marrow spaces, and itis means inflammation. So inflammation of the bone and the bone marrow is called as osteomyelitis. The clinical features of an osteomyelitis includes intraoral or extraoral swelling with severe bone pain, mobility of the involved tooth, draining sinuses as you can see in the picture above, paresthesia of the lip. Radiographically, there are altered trabecular pattern, presence of involucrum, sequestrum, and moth-eaten appearance which you can see on the left body of the mandible in the OPG. Severe long-standing cases can end up in a pathological fracture. The treatment of osteomyelitis includes broad-spectrum antibiotics like clindamycin and penicillin, followed by a surgical curettage. Inflammation of the pericoronal tissue surrounding an erupting tooth is called as pericoronitis. The term pericoronitis is used synonymously with an erupting upper and lower third molar tooth. It can usually occur between 17 to 30 years of age, and here patient will have an inflamed pericoronal flap, food accumulation, suppuration beneath the flap, regional lymphadenitis, trismus or pus accumulation which can lead to an extraoral swelling, and it is called as a pericoronal abscess. The investigations for a pericoronitis includes radiographs to assess the position of the erupting tooth. Patient should be prescribed analgesics and antibiotics. If the tooth can erupt into the oral cavity into occlusion, then an operculectomy should be done. If the tooth is impacted, then the tooth should be surgically extracted. Disorders involving the structures surrounding the tooth, namely the gingiva, alveolar bone, cementum, is called as periodontal diseases. The prominent radiographic change of periodontal diseases are widening of periodontal ligament space, loss of lamina dura, and crestal or interdental bone loss. Here is a picture which depicts a normal appearance of periodontal ligament, lamina dura, and normal level of an interdental bone. This is a radiograph of an upper anterior and a lower molar teeth. The commonest periodontal disease is the inflammation of gingiva, which is called as gingivitis. This is a case of marginal gingivitis. The marginal gingiva, attached gingiva, and interdental gingiva becomes red, inflamed, tender, and bleeds on probing. Inflammation of the gingiva can then extend into the periodontium, which is called as periodontitis. Based on the clinical signs like gingival recession, periodontal pocket formation, furcation involvement, mobility of teeth, and radiographic findings like horizontal or vertical bone loss, periodontitis can be classified as early, moderate, and advanced periodontitis. Suppuration and pus formation in the periodontal region can lead to an intraoral or an extraoral swelling which is called as a periodontal abscess. As shown in the photograph is a periodontal abscess in the lower molar tooth, and that is a radiograph which shows the periodontal abscess. Tooth is free from dental caries. There is deep periodontal pocket, pus discharge from the sulcus, and mobility of the tooth, and radiograph will show a bone loss. Thank you.